With Paul Harris filling in from McGraw this morning, thanks very much for listening. It has been 50 years since the Surgeon General of the United States issued a report on tobacco talking about the true dangers of smoking. Since then, other Surgeon Generals have reinforced that message, and smoking now is at a level that is lower than it has been in quite a long time. Joining me here now to talk about that is one of the former Surgeon Generals who is celebrating the 50th anniversary of that report, Dr. David Satcher. Dr. Satcher, welcome to the Big 550.
Thank you, Paul. It's great to be with you.
Where are we now in tobacco use in this country?
Well, I think there's good news and bad news. As you point out, 50 years ago, 45% or so of the American people were smokers when the report was released. Today it's down to 18%. So we have to celebrate that and the fact that we estimate that 8 million lives have been saved because of the things that have taken place. And those things include education of the community and of children. They include restricting the sale of tobacco to children. They include policies restricting smoking in public places. All of these things and more, the tremendous research that continue to provide new information, because as you know, every Surgeon General since Luther Terry has released a report, at least one report on smoking and health. Mm-hmm. So that's good news, but the bad news is that, of course, 450,000 or so people still die each year from smoking. It is still the leading preventable cause of death in this country. And not only that, 90% of people who smoke begin to smoke before they're 18 years of age and are addicted. So we have a major problem. The most recent report that was released 2 weeks ago pointed out things that we didn't know about the impact of smoking. We knew about lung cancer. We knew about chronic obstructive lung disease. But this most recent report points out that smoking increases diabetes risk, colorectal cancer, macular degeneration, and erectile dysfunction. All of those are impacted by smoking. So the reason we do these reports, and every Surgeon General a new report, is because there's new information, new research. So we have to continue to get smarter. We have to continue to do a better job of making smoking unpopular as opposed to cool. And I think when a state like California, which in 1987 passed the first state policy saying you cannot smoke in public places, now there are 26 states that have those policies. Those are the things that we have to continue to work on, because not only do they limit smoking, they convince other people to not begin to smoke in the first place.
Do you think peer pressure has also been part of the reason for the decline, with more non-smokers saying, hey, you know what, I don't want to have to be around you and have to go home and smell like your ashes all day long?
Most definitely. And when a state says that it's illegal to smoke in public places for various reasons, including it's not fair to people who are around you, I do think you're right. I think it makes it unpopular to be a smoker. And the more unpopular it becomes, the fewer people who are going to begin to smoke in the first place, and the more people who are smokers who are going to try to quit.
You mentioned that each Surgeon General of the last half century has issued a report on tobacco. In your first year as Surgeon General, your report was about tobacco use among ethnic minorities in this country and racial minorities in this country, and it actually reported that that smoking was on the rise among kids in those groups. Has that reversed itself too?
Well, let me say a couple of things. I think smoking being on the rise in those groups was real, but I think generally we had a downturn in smoking among adolescents for a few years. It's just beginning to creep back up a little bit. But it was true that not only was on the rise, for example, lung cancer death from smoking was highest in African-American men. And in that report, of course, we even pointed out that American Indian women, that's one of the areas where smoking was increasing dramatically. And so, yes, you're right, and thank you for recalling that report from 1998. But we made progress in all of those groups. Our fear, though, is that we have to continue to be aggressive about getting the message to young people so they don't become addicted, because 90% of people who become addicted to smoking begin smoking before they're 18 years of age.
What do you think of the rise of e-cigarettes?
Well, let me say a couple of things, just to be fair. Um, E-cigarettes has the advantage, of course, of not impacting people around you, secondhand smoke, and they also don't have all of the chemicals. Having said that, they do have nicotine, and I don't think we should encourage anybody to begin at least a habit in which they are likely to become addicted to nicotine. That is not good. That is not healthy. So you have to have mixed feelings about e-cigarettes. You have to say, well, if people are going to smoke, then at least they're not contaminating the environment, as you pointed out earlier.
Right.
And also, they're not getting all of the other chemicals, but they are getting nicotine. And I just think that we should not encourage anyone, especially to begin the regular use of nicotine, whether it's through e-cigarettes or regular cigarettes, excuse me.
Yeah, I hope that people aren't going to start using e-cigarettes because they're cool, and now that, they're still inhaling nicotine. But for those who are smokers, and I've got a couple of friends here on our staff who have been heavy smokers for a long time, and they've recently just bought e-cigarettes, and they're sucking away on those things all day long. Is that a healthy way for them to wean themselves off of real cigarettes?
I think the jury is still out. That's why the Food and Drug Administration has not yet established its policy toward e-cigarettes, and they are still studying it. Great question. I think we know that e-cigarettes are addicting if you're not already addicted, but your question is a critical one. For people who are already addicted to nicotine and they change to e-cigarettes, you can say two things. Number one, they're not getting all of the chemicals that they were getting before, and number two, they're not contaminating the environment. Having said that, there's still a lot to learn about e-cigarettes. I would not encourage young people to begin to smoke using any kind of nicotine.
We still have states in this country that have very low cigarette taxes, from a low of something like 17 cents in the Midwest to as high as $5.85 in places like New York State. Do you think that government should be dissuading people from smoking through those sin taxes?
I think government should be doing everything it can to discourage people from smoking because government pays much of the price when people suffer from lung cancer, cardiovascular disease, colorectal cancer, erectile dysfunction. Through Medicaid and Medicare, government pays a lot of the bill. It's therefore very appropriate for government to try to discourage smoking and to do everything it can to help people to quit smoking.
Former Surgeon General Vice Admiral Dr. David Satcher on the 50th anniversary of the Surgeon General's Tobacco Report. Thank you so much for joining me here today.
Quite welcome. Great being with you, Paul.
I'm Paul Harris. This is the Big 550 KTRS.